Thank you for joining me today. My name is Joseph Mitchell, and this is a DNP education initiative for NU 712 Clinical Prevention and Population Health. PrEP is a focused community health coalition which will examine the influence of HIV on the U.S. population, particularly in the South. The coalition will feature a community-based DNP-led program that aims to enhance the quality of life for those involved. The next 3 slides introduces the table of contents. Please take a brief moment to review as we move along through the rest of this presentation. The objectives of the coalition are presented here on the following 2 slides and are intended as a guide. They include portraying instabilities in the current health models for the LGBT population, identification of essentials needed for LGBT population inclusion, defining primary preventative strategies, describing the health initiative framework, distinction of 2 DNP competencies for implementation of the program, and finally, recognition of measures of success for the program. HIV, what is it? HIV is an acronym for the human immunodeficiency virus. It is a lifelong chronic condition, and currently there is no cure. How do we define gay men as a vulnerable population? Conferring with CDC 2018 estimates, gay and bisexual men account for 67% of the nearly 41,000 newly diagnosed HIV cases in the U.S. Approximately 1.2 million Americans are living with the disease, and 1 out of 8 are unaware of their status. Bayer, 2012, professed that gay men bear an unequal obligation in relation to HIV, where they are being precluded from receiving health services due to imputation, injustice, and laws criminalizing being gay. So how do we reduce the risk? According to CDC 2018, HIV was the 9th principal cause of demise for those between the ages of 25 to 34 years and those between the ages of 35 to 44 years in 2015. Higher incidences of tobacco use, illicit drug use and abuse, and alcohol consumption were all found to be leading causes of morbidity and were associated with increased HIV transmission. Consistent condom use reduces HIV transmission on average between 63% and 72%, as pointed out by CDC 2016. Stallman, 2017, advocate that men who have sex with men who have experienced stigma have decreased rates of HIV testing, they dread or evade pursuing medical care, and they engage in unprotected anal sex. Taking PrEP can reliably reduce the probability of HIV transmission by 90%. Engaging in oral sex has been shown to have little to no transmission, and the CDC recommends getting tested and early treatment as a preventative measure. Eaton et al. 2015 state that inattention to psychosocial obstacles hinders the evolution of biomedical prevention and undermines our capacity to facilitate effective tactics for deterrence and treatment of HIV. Further, the study found that 29% of participants recounted suffering shame regarding their ethnicity from healthcare providers, and 48% conveyed distrust of medical establishments. HealthyPeople.gov 2018 reports that gay aggregates encounter health inequalities related to societal stigma, judgment, and repudiation of their civic liberties, and privileges, leading towards higher rates of drug abuse, self-harm, and mental disorders. We must reduce this stigma by incorporating culturally sensitive and appropriate training among healthcare workers to ensure surveillance monitoring in all levels of care. The National HIV/AIDS Strategy, according to the HIV.gov 2017, was employed as a communal national antiphon to the HIV endemic. The vision statement endorses the U.S. as being a place with sporadic infections. However, when these illnesses do occur, social determinants of health will not affect the individual's ability to access high-quality, equitable care free from shame. The four goals of the National HIV/AIDS Strategy is reduction of any additional HIV infections, augment the accessibility to care and refine health impacts for those affected with HIV, reduce disproportions and imbalances of health that are associated with HIV infection, and attain a further organized national riposte to HIV prevalence. What is PrEP? PrEP stands for Prepared, Readied, Early Primary Prevention. It is a DNP-led interdisciplinary community commitment that will address health-related education awareness related to HIV. It is an innovative undertaking to increase the caliber of life for those affected with HIV. The plan encourages active participation of a multiple disciplinary panel for primary prevention of HIV infection through increased testing, access to health care, and decreased stigma. We will offer education for healthcare providers specific to HIV and related topics. We will offer supportive counseling for substance and alcohol abuse. We will offer free in-home testing kits, encourage quarterly testing, and involve the community in advocating for health policy changes. Outcomes of PrEP. We would like to reduce the prevalence of HIV in this community by 20% in 1 year. We would also like to increase community health services specific to gay men to encourage their participation in surveillance and decrease the stigma associated with the diagnosis of HIV. These specific measures align with the National HIV/AIDS Strategy. Curley and Vitale 2016 state sound methodology and data compilation combined with a comprehensive research scheme are the underpinnings for a good intervention which can decisively impact evidence-based practice. The DNP promotes program goals, milestones, and results. He or she utilizes the Precede-Proceed model as a framework for PrEP Health Coalition. They work thoroughly with technology specialists in development and utilization of databases to amplify their capacity in delivering the Health Coalition goals and milestones. They authenticate and commune program management. They manage and guide team associates. They ascertain resources that will be mandatory for coalition success, and they cultivate action policies for areas of enhancements that have been identified. Collaborations. There are a multitude of collaborations which include community leaders, physicians, RNs, ADN and BSN, and LPNs, the county health department, local acute care centers. Eden et al. 2015 affirmed that the usage of biomedical tools in thwarting the spread of HIV will be unsuccessful if those in need are disengaged to treatment that can expedite access to and examine the use of strategies such as microbicides, PrEP, and other interventions. John, Rendina, Grove, and Parsons 2017 asserted that uneasiness in speaking with a physician about PrEP was documented as one potential obstacle among gay and bisexual men. The RN, ADN, and BSN, and LPN will participate in the delivery of care personalized to meet the needs of the LGBT population. They will partner with the DMP to collect and relay surveillance data. They will assist members of this population in developing safer, healthier sexual practices and behaviors. They will reduce the risk factors for HIV transmission. The use of the Denver HIV Risk Score Assessment Screening Tool will be implemented as a reliable measure in estimating which patients should be selected for testing who arrive in emergency departments. The appraisal of program outcomes to national quality will guide the APRN to expand patient outcomes and lessen the cost. DMP competencies required for execution of this health initiative are adaptability, which is openness to innovative thoughts, and they will seek out fresh approaches. They will acclimate to fluctuating states. Diversity is another key component that will allow them to perform positively with individuals who vary in ethnic background, gender, or age. It encourages the distinctive attitude and perceptives of others. In summary, being prepared and ready with this early primary preventative health initiative is the only way to combat the HIV endemic. PrEP is a collective effort for the communities of Calhoun County to take action against this disease. Following national guidelines enables those in this area most affected by it to gain access for needed services. Amid a multidisciplinary array, this collaborative effort's success will depend on a variety of factors. The APRN will lead this initiative through a variety of leadership competencies with emphasis on two: adaptability and diversity. It is my honor to have presented this community-based coalition health plan. Thank you again for joining me for this presentation.